Environ Life Science Limited, partnering for life.
Hello everyone, I'm Dr. Sushruta. I work as a skin specialist in Safdarjung Hospital. Today I'll be talking about skin infection. Now all of us have undergone some sort of skin infection at some point of time, and we see skin infections in our OPD on a regular basis. Now skin infections can be caused by bacteria, by fungus, by viruses and even parasites. Firstly, let's talk about bacterial infections. Bacterial infections usually present on the skin as pustules, tiny yellow colored bumps with redness around them. Sometimes they are associated with itching. Sometimes they become larger and form abscesses. Sometimes they can drain pus. This is commonly termed as fungi or bartol by the general common man. Now we see this very commonly. It happens very frequently in the summers in hot and humid conditions. It is also very common in diabetics or patients who have decreased immunity, and usually it is caused due to common bacteria like staphylococcus or streptococcus. Now how do we treat them? So treating of bacterial infections is very easy. You need to treat it with an antibiotic. Now antibiotic can be either applied in the form of a cream. A commonly used cream is fusidic acid. We can also use mupirocin or even higher antibiotics like ozenoxacin. Now sometimes it's not just sufficient to use an antibiotic cream. We need to take an oral antibiotic also. However, let me warn you that no antibiotic cream or medicine should be self-medication. It should always be done in consultation with a dermatologist. Now what are the commonly used oral antibiotics that we have? So we have amoxicillin, we have amoxiclavulinic acid, we also use cefadroxil, and if needed we can go to higher antibiotics like clindamycin and linezolid also. The dose is decided by a dermatologist, and it's taken for about 5 to 7 days. An incomplete dose or an incomplete duration will not help in the long run because the things will come back. The infection is going to come back if you don't take the complete course of treatment. Now along with that, we also need to do a lot of precautions. We need to keep the area clean. We need to use soap and water regularly on the area so that further dirt and infection doesn't accumulate over that. Along with that, we need to keep the area dry. Hot and humid conditions lead to worsening of the disease. We also need to keep our diabetes under check. The blood sugar has to be controlled. A very common thing which I've seen people doing is to apply Dettol and Savlon, which is a big no-no. Dettol and Savlon are disinfectants which is supposed to be used on non-living things, not on living things like the skin. It can lead to a lot of irritation on the skin and can worsen the disease. Also, a lot of people use antibiotic powders. In the past, it was very common to use antibiotic powders. But the problem with powders is that it leads to caking when it mixes with the pus, and then it prevents the healing. So that should also be avoided. The best thing is to just use a mild soap and water and clean it twice a day. Along with that, you also need to change your clothes frequently, not use the repeated clothes every day, or stay in unhygienic conditions, or sharing of clothes with people who have such diseases. One should avoid all that to prevent a recurrence. Also, a lot of people use self-medication. They go to the chemist, ask for a cream, and what do they get? They get a combined cream which has steroid also. So we must know that steroids leads to worsening of these skin infections, and that should not be done. So this is all about skin infections. Sometimes what happens is that these small pustules become very large and they form abscesses. This can lead to a lot of pain. This can also lead to fever sometimes. In that case, not only the antibiotics, one also might need to get a surgical drainage done. That again is done in consultation with a surgeon and not self-done. It should not be done on our own. So these are some of the do's and don'ts and how to treat a bacterial skin infection. Now coming to the viral infections. A common viral infection is chickenpox. We see it commonly. Kids have it, adults have it. So it's a mild disease. It is caused by varicella virus. Now what happens in this is usually it starts with fever, which is quite high. Then in a day or two you start developing a rash. This rash usually has water-filled bubbles on the skin. It starts from the face, head and neck and can go downwards. It can also involve your hands and your feet. In due course of time, in 4 to 5 days, they start drying up and they form a scab. Now after that, itching starts and slowly the scab falls off. The entire process takes about 10 to 14 days. Now one must understand it's a self-limiting disease. Chickenpox is a self-limiting disease. But sometimes what happens is that the symptoms are quite severe. So we need to treat it. Now usually supportive measures are enough, especially in children. It's very easy. You can manage it just by an antipyretic or something, or an analgesic, and further when the itching develops you can give an antihistamine and things settle down. Sometimes in adults or in people who have low immunity, what happens is that the disease takes a severe course. In that case, we use antivirals like acyclovir. Again, it should not be done as self-medication, which I am repeatedly highlighting. It has to be done in consultation. Whatever treatment you take should be in consultation with a dermatologist. The important thing to take care during chickenpox is one has to take bath. There was a misconception earlier that you don't take bath. If you don't take bath, the lesions don't stay clean and there's going to be secondary infection. So that has to be avoided. Always recommend that you take bath. Once the patient starts feeling better, once the fever is down, please do take bath with soap and water. It is a must. Another common problem that we see, an infection, a viral infection, is a viral rash which occurs with fever. It is very common with children. And in our past, we've seen with COVID, we've seen with hand, foot and mouth disease. These all epidemics have come and we've seen a rash which can sometimes be just redness, sometimes have fluid-filled vesicles also, and they're associated with symptoms of itching. Now the thing is that all these have to be treated symptomatically. There is nothing to panic about it. But yes, to confirm your diagnosis, you need to consult a dermatologist. Then we come to our parasitic infections. So a common parasitic infection that we come across is scabies. Now what is scabies? Basically, these are small mites which attack the body and they stay in our beds, they stay in our clothes, web spaces of the fingers. At night they usually come out. So such patients usually complain of itching which worsens at night. And once one person is affected, everyone around him who cohabits with him starts getting the same symptoms. Some people are very hygienic, very clean, but they have a history of traveling, trekking, staying in some unknown resorts or small guest house where the hygiene level may not be so high. So in that case, they have very small bumps on their skin. They have generalized itching and they have small lesions on their skin by which we can make out that this is scabies. The treatment of scabies is very easy. You just need to use permethrin. Once at bedtime, apply all over your body. Let it stay all night. In the morning, take bath. Then again, you have to repeat this medication once more after a week. But the catch here is, it's not only treatment of the person who has come, but also treatment of all the people who share the living quarters with him. Because if that is not done, the disease is not going to go from the house. In that case, what's going to happen is, after a 4-week period, another person is going to complain of the similar symptoms of itching. So the cycle is not broken. As a result, whenever one person is treated for scabies, all people who share his bed or his living quarters should be treated. At the same time, all the clothes should be washed and then reused. All the bedding needs to be cleaned and then reused. So that's all about our skin infections. Thank you very much and I hope it's been informative enough.